Don't make this fine mistake if you take your grandpa to the emergency room. Welcome everyone. Today we'll explore a concept I call the fine mistake in geriatric care. This common family misconception can obscure a patient's true baseline health and lead to suboptimal care. Together we will examine why understanding this error is essential for addressing the needs of older adults in emergency settings and beyond. This is Dr. Armin Sharokny, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. When families say their loved one was fine before an illness, they often mean that the patient's needs were being met by a stable support system. However, this can mask underlying vulnerabilities. As needs increase or support systems weaken, a tipping point is reached, leading to an ER visit. Recognizing this is key for accurate assessments. This slide illustrates the balance between increasing needs and decreasing support in aging individuals. As patients require more assistance with activities like mobility or medication, family support may wane due to competing obligations. Understanding this imbalance helps clarify how crises emerge and informs tailored interventions. Medical documentation often mentions that patient was in his or her usual state of health, but what does that truly mean? For effective care, we must dig deeper, identifying baseline functions and the level of support received. This deeper understanding is pivotal in preventing avoidable crises and maintaining geriatric health stability. Families often view their loved ones through an emotional lens, and their description of fine reflects optimism rather than objective health. This isn't deceitful, but a coping mechanism. As clinicians, we must empathize with their perspective while educating them on the value of precise assessments to ensure comprehensive care. When caring for older patients, it's vital to look past the immediate presentation, assess their ability to manage activities of daily living, and examine their support systems, including friends, family, and formal care. Don't overlook emotional health. Changes in mood, cognition, or sleep can provide critical insights. Accurate assessment relies on clear communication. Educate families on its significance, focusing on how their loved one's complete health picture impacts care. Collaborate with them to align plans with patient and family goals, and empower them through resources to actively participate in managing ongoing needs. To conclude, remember the fine mistake refers to balance between the patient's needs and the support he or she is receiving. A patient being fine does not necessarily mean that the patient is well. Perform holistic assessments beyond acute symptoms to evaluate function, support, and well-being. Most importantly, engage families with education and collaboration to ensure effective, patient-centered care. If you enjoyed this video, please like it, share it with your friends and family, and subscribe to the channel. Thank you for watching. Genim bandages wrapped his hand, but his gaze was on the small plastic tank. "Still swimming, Finney?" he rasped, his voice thin. The goldfish circled, a tiny orange blur. "Good," he whispered, a flicker of a smile touching his lips. "Just keep swimming." The rhythmic gurgle of the tank's filter was the only other sound in the sterile room, a small, fragile connection to life outside his pain. The old man was suffering from delirium. Delirium is a common but often misunderstood complication seen in hospitalized patients. It usually stems from treatable or manageable causes. In today's video, we will explore the common underlying factors that can contribute to the old man's delirious state. This is Dr. Armin Sharokny, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. When facing delirium, neurological events like stroke might seem like the obvious cause. However, unless acute neurological symptoms are present, it's essential to investigate other causes. Conditions such as hypoxia, urinary retention, or dehydration are more frequent triggers, and recognizing these early allows caregivers to take timely actions that can prevent worsening symptoms. Hypoxia, or low oxygen levels in the body, often contributes to delirium. Conditions like pneumonia or viral respiratory infections can significantly drop oxygen levels, as can heart failure. Additionally, patients who skip using prescribed supplemental oxygen may unknowingly worsen hypoxia. Always ensure oxygen use is prioritized to support recovery. Hospitalization can be stressful, even for something as basic as bladder function. This stress, coupled with certain medications like anticholinergics, can lead to urinary retention, a little-known factor behind delirium. Fortunately, simple interventions like catheterization often offer quick relief, significantly improving patient comfort and cognitive clarity. Dehydration is a surprisingly common but preventable cause of delirium. Hospital routines like fasting for procedures can leave patients underhydrated, exacerbating confusion. Even mild dehydration can impact brain function, so ensuring regular hydration is a simple yet powerful way to prevent delirium. Certain medications commonly used in hospitals, such as anticholinergics, antihistamines, benzodiazepines, or opioids, can lead to delirium. These drugs affect brain chemistry, especially in older adults. As caregivers, staying mindful of medication effects helps in promptly identifying and addressing any emerging issues. Infections, particularly urinary tract infections, and imbalances in sodium levels are the other causes of delirium. A sudden shift in electrolytes can disrupt brain function dramatically. By closely monitoring and addressing these conditions, you can help stabilize patients and reduce confusion. Even seemingly minor issues like constipation can lead to delirium, especially in older patients. Finally, liver dysfunction can also cause a condition called hepatic encephalopathy, is another potential cause. Early detection and intervention are key to mitigating the negative impact of delirium on a patient's overall cognitive function. Caregivers play a critical role in helping care providers explore these factors. If you enjoyed this video, please like it, share it with your friends and family, and subscribe to the channel. Thank you for watching. Dr. Albright frowned at the MRIs. No plaques, no atrophy. Mrs. Henderson, though, was lost in time. Her stories fragmented, her gaze distant. Then a forgotten grandchildren visited. They brought a digital photo album, its pages filled with laughter and shared memories. As Mrs. Henderson turned the pages, a spark ignited in her eyes. The fragmented stories began to weave together, the distant gaze focused. Not dementia, Albright realized, but a soul buried beneath the weight of unspoken grief, slowly finding its way back to the light. Memory loss can be concerning, but it's important to remember it doesn't always indicate dementia. Many factors, such as vitamin deficiencies or depression, can cause temporary memory issues. By understanding how these conditions affect cognition, you can take steps to address and often reverse these changes. This is Dr. Armin Shahrakni, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. Vitamin B12 deficiency can cause symptoms like confusion, difficulty concentrating, and forgetfulness, mimicking dementia. The good news is that these effects are often reversible with B12 supplementation and a diet rich in B12 sources like fish, eggs, and fortified cereals. Early detection is important to restore memory and cognitive function. A lack of folate, another essential nutrient, can lead to forgetfulness, decision-making challenges, and confusion. Treatment includes folate supplementation and consuming leafy greens, beans, and citrus fruits. Addressing this deficiency not only improves cognition but also promotes overall brain health. An underactive thyroid or hypothyroidism can slow thinking, cause fatigue, and impair memory. These symptoms can be effectively managed with thyroid hormone replacement therapy, which gradually restores normal function. Regular screenings are key to identifying this often overlooked cause of memory issues. Depression can manifest as confusion, memory loss, and difficulty focusing, closely resembling dementia. With proper management, including talk therapy, medication, and improved lifestyle habits, cognition often dramatically improves. Recognizing symptoms of depression ensures individuals receive the care needed to thrive. Acting early when memory issues arise is crucial. Identifying treatable causes through thorough assessment can lead to effective interventions, improving both memory and quality of life. Support systems, including counseling and group resources, further help individuals and families navigate challenges with confidence. Healthy habits make a difference in maintaining cognitive health. Engage in activities like puzzles and reading to stimulate the brain, embrace a balanced diet and exercise, and build strong social connections. These actions collectively nurture the mind and promote long-term mental wellness. If memory concerns arise, don't wait to consult a healthcare provider. Comprehensive evaluations can pinpoint the cause, whether treatable or requiring management strategies. Seeking help early ensures the right support and care to maintain cognitive integrity and quality of life. If you enjoyed this video, please like it, share it with your friends and family, and subscribe to the channel. Thank you for watching. The daughter anxiously asked, "Am I losing him? Why he is so confused?" The daughter is not alone in this feeling. You may also have been confused about your older loved one's sudden change in mental status and confusion. The mysterious condition that can cause otherwise lucid individuals to become confused, disoriented, and experience vivid hallucinations is known as delirium, a condition that often strikes swiftly and can have profound consequences for those affected. This is Dr. Armin Sharokny, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. One hallmark of delirium is its sudden onset, occurring over hours or days. You can usually recognize the exact date and even time when such an acute change happened. This swift shift in mental state demands urgent attention. Early detection is vital. Timely intervention can significantly impact its severity and improve recovery outcomes. Delirium symptoms fluctuate throughout the day, often creating a cyclical pattern of lucidity and confusion. Careful observation and documentation are essential to track these changes. Such vigilance assists medical professionals in diagnosing and managing this challenging condition effectively. Delirium often causes significant focus and attention deficits. Patients may be easily distracted, struggle with everyday tasks, or lose track during conversations. This impaired attention can lead to frustration and a decline in functionality, impacting both the individual and their caregivers. Disorganized thinking is a notable sign of delirium, manifesting as incoherent speech or jumping between unrelated ideas. These cognitive struggles can also complicate processing information or understanding instructions, further impairing meaningful communication. Patients with delirium can experience varying states of consciousness, from hyperalertness and agitation, also known as hyperactive delirium, to extreme lethargy, also known as hypoactive delirium. Patients suffering from hypoactive delirium usually stay in bed for hours and even days and have minimal interaction with others. Sleep disturbances often exacerbate these fluctuations, worsening disorientation and complicating patient care. Emotional volatility is another characteristic of delirium, presenting as anxiety, irritability, or paranoia. In severe cases, hallucinations or delusions may occur, causing immense distress and requiring empathetic, focused care from healthcare providers. Prompt recognition of delirium is critical, as it can lead to severe consequences like increased hospital stays or even mortality. By understanding its key characteristics, sudden onset, fluctuating symptoms, and reversibility, you can deliver timely and effective care to affected individuals. In the following video, we will discuss the underlying medical reasons that can cause delirium. If you enjoyed this video, please like it, share it with your friends and family, and subscribe to the channel. Thank you for watching. Mr. Davis, a retired accountant with a passion for crossword puzzles, was determined to fight his recent cancer diagnosis. He underwent chemotherapy, but as the treatments progressed, he noticed a troubling change. The once sharp mind that effortlessly navigated complex tax forms now struggled to recall simple words and appointments. He found himself searching for misplaced keys and forgetting familiar recipes. Frustrated and concerned, Mr. Davis confided in his doctor, who explained that chemotherapy can sometimes cause cognitive changes, often referred to as chemobrain. While the exact cause is unknown, it is believed to be related to the effects of chemotherapy on the brain. With the support of his medical team and family, Mr. Davis began cognitive rehabilitation exercises and learned strategies to manage his memory challenges. Gradually, he found new ways to engage his mind, proving that even with chemobrain, life could still be fulfilling. Welcome to this presentation on chemobrain. Cancer treatment can sometimes impact how clearly you think, making tasks like remembering or concentrating more difficult. Today, we'll uncover what chemobrain is, why it happens, and share steps to manage it effectively. Together, we'll shed light on this often overlooked side effect to help you feel supported and informed throughout your journey. This is Dr. Armin Shahrokny, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. Chemobrain, also known as cancer-related cognitive impairment or cancer fog, refers to cognitive challenges like memory loss or reduced focus experienced during treatment. It's important to know this isn't rare. Many cancer patients report these symptoms, regardless of their specific cancer type or therapy. Let's explore how this condition impacts mental clarity. Chemobrain shows up in different ways. You might struggle to recall conversations, names, or dates, face trouble multitasking, or need more time to process familiar tasks. Words may occasionally escape you during conversations. Recognizing these symptoms is the first step toward effectively managing them. Several factors contribute to chemobrain. The cancer itself, treatments like chemotherapy or radiation, and medications can all play a role. Conditions like anemia or hormonal shifts, along with stress and anxiety, may also worsen cognitive changes. Understanding these triggers can help in developing strategies to address them. Chemobrain symptoms often start during active treatment and usually improve over months. For some, effects may persist for years, while a small percentage might notice enduring changes. Identifying your own timeline is vital to managing expectations and finding the support you need. Taking proactive steps can ease chemobrain symptoms. Tools like planners or memory games help stay organized, while regular physical activity boosts brain functions. Prioritizing quality sleep and engaging in cognitive exercises can further support recovery. These simple adjustments can make daily life smoother. If you notice persistent symptoms, seek guidance from your healthcare team. Oncologists can rule out other causes, neuropsychological testing pinpoints difficulties, and cognitive therapists provide personalized exercises. Joining support groups also connects you with others who truly understand this journey. Research is advancing to understand and prevent chemobrain. Long-term studies are helping us track recovery patterns, while innovative treatments aim to minimize cognitive impacts. Exciting developments in targeted therapies give hope for better support in the future. If you enjoyed this video, please like it, share it with your friends and family, and subscribe to the channel. Thank you for watching. "80-year-old Mrs. Johnson, a vibrant woman with a love for gardening, was admitted to the hospital for a fall. While she seemed physically stable, her usual sharp wit seemed dulled. Dr. Ramirez, a geriatrician, recommended a comprehensive geriatric assessment. The assessment revealed subtle signs of cognitive decline, previously masked by Mrs. Johnson's determination. It also identified social isolation due to her declining mobility, which had limited her gardening activities. With a clearer picture of Mrs. Johnson's needs, the team developed a targeted care plan. Physical therapy addressed her mobility issues, cognitive stimulation exercises engaged her mind, and social work connected her with community resources for gardening support. Upon discharge, Mrs. Johnson was not just physically stronger, but also mentally sharper and socially connected, allowing her to return to her beloved garden and maintain her independence. This is an example of the power of geriatric assessment. This is Dr. Armin Shahrokny, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. Geriatric assessments provide a thorough evaluation of older adults' health, focusing on improving their independence and overall well-being. This process, conducted by specialized care providers, typically spans about an hour but offers invaluable insights into individualized care needs. Understanding daily living capabilities is crucial for geriatric care. Basic activities like bathing and eating, alongside instrumental tasks such as managing finances, are evaluated. This assessment also identifies essential needs, including assistive devices and risks like falls, ensuring a safer and more adaptive living environment. An older adult's living arrangements and support systems have a profound impact on their health. This includes assessing who they live with, their caregivers' well-being, and the availability of formal assistance at home. Improved caregiver support and social stability directly enhance patient care outcomes. Detecting mental health concerns early is vital for effective intervention. This screening focuses on signs of depression, anxiety, or stress. By integrating mental health into geriatric assessments, providers can address these challenges promptly and significantly improve quality of life. Cognitive health directly affects an older adult's independence. This evaluation identifies dementia or cognitive declines that may increase dependence on others. By understanding cognitive deficits, clinicians can devise suitable interventions to sustain autonomy and improve patient care. Nutritional health is foundational but often overlooked. This assessment captures recent weight changes, appetite levels, and challenges in accessing or preparing meals. Addressing these issues prevents malnutrition and promotes healthier aging trajectories. Medication management is critical in elderly care. This review examines the patient's medication load, side effects, and drug efficacy. By evaluating these factors, healthcare providers can reduce risks tied to polypharmacy and ensure treatments align with health goals. Geriatric assessments provide a comprehensive picture of an older adult's health, informing personalized care plans to enhance quality of life. Through regular evaluations, health professionals can promote independence, detect challenges early, and deliver well-rounded, impactful care. Seek the Secret Service for Seniors. Geriatric assessment, performed by a geriatric care provider, wherever you can find one. If you enjoyed this video, please like it, share it with your friends and family, and subscribe to the channel. Thank you for watching. When 86-year-old Mrs. Peterson's daughter noticed her mother had lost a significant amount of weight, she became concerned and took her to various doctors. Although a thorough examination of Mrs. Peterson's gastrointestinal tract revealed no issues, doctors remained worried about the possibility of cancer and suggested more invasive tests to look for cancer. The daughter, frustrated with the lack of answers about mom's weight loss, made an appointment with the geriatrician. During that visit, Ms. Peterson shared that she had been under a lot of stress and was experiencing major depression due to an emotional trauma she had endured the previous year. She agreed to try antidepressants and talk to a psychologist. She said, "At the minimum, this sounds better than going to many more doctors." Over time, Mrs. Peterson's mood improved significantly, and she regained most of the weight she had lost. She had depression of mind, not cancer of the body. Weight loss in older adults is a widespread concern, affecting roughly 25% of seniors. If your loved one appears noticeably thinner without intention, it could indicate underlying health issues. Today, we'll dive into the causes of unexplained weight loss in seniors, the warning signs to monitor, and practical strategies to promote their health and well-being. This is Dr. Armin Sharokny, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. Unexplained weight loss occurs when someone loses a significant amount of weight over 6 to 12 months without changing their diet or lifestyle. Alarmingly, this affects about 1 in 4 older adults. Watch for warning signs like diminished appetite, forgetfulness, or weakened strength, and ensure these are discussed with their healthcare provider promptly. Many health conditions, such as cancer, diabetes, or gastrointestinal problems, can disrupt appetite or digestion, leading to weight loss. Likewise, Limited mobility weakens muscles faster than fat is lost, exacerbating the problem. Lastly, chemical imbalances can prevent proper nutrient absorption, further contributing to the issue. Medication side effect can alter taste or smell, causing a meal to become unappealing. Some may also lead to nausea, vomiting, or swallowing difficulties, making eating uncomfortable. If weight loss occurs, it is critical to review medications with a healthcare provider to address these challenges effectively. Forgetting to eat or being unable to prepare meals due to cognitive decline, like dementia, can result in weight loss. Depression similarly affects eating habits and self-care routines. Adding to the risk is social isolation, which deprives seniors of mealtime company, leading to irregular eating patterns. Seniors with limited incomes often struggle to afford balanced meals, impacting their nutrition. Physical discomfort while eating, such as from chewing or swallowing issues, further deters healthy eating habits. A lack of caregiving support compounds these problems, making meal preparation and grocery shopping overwhelming tasks. Start with a thorough medical evaluation to uncover the root causes of weight loss and seek professional guidance. Treat any identified medical issues appropriately, from chronic conditions to medication adjustments. For unresolved problems, nutrition recommendations and consultations with dietitians can help meet dietary needs. Promote regular exercise, including strength training, to maintain muscle mass. Encourage protein-rich foods, fiber, and hydration to support health. Additionally, foster social interactions to reduce isolation and inspire consistent eating habits. Remember, early intervention improves outcomes when weight loss concerns arise. If you enjoyed this video, please like it, share it with your friends and family, and subscribe to the channel. Thank you for watching. Have you ever wondered why a healthcare provider made a decision for your treatment just based on your age? I am sure you asked yourself that there should be a better way other than just looking at my age. That's true. The answer is frailty. This is Dr. Armin Shahrukni, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. Today, we explore how frailty plays a crucial role in cancer treatment decision-making. While age has often been the primary focus of many treatment decision-making, this presentation highlights the importance of assessing a patient's overall health and functional status to create more effective and personalized treatment plans. Historically, cancer treatments were often based on a patient's age, which could limit options for older adults. By shifting focus to frailty, we embrace a more personalized approach, evaluating a patient's physical, cognitive, and social resilience to tailor care effectively. Frailty signifies a heightened vulnerability to adverse outcomes due to reduced tolerance to stress. Frail individuals face increased risks of complications and hospitalizations. However, assessing frailty enables personalized care that balances the benefits of treatment with the patient's overall well-being. Research underscores the link between frailty and cancer treatment outcomes. Frail patients are more likely to face complications and poorer prognoses, while non-frail patients typically experience better survival rates and quality of life, emphasizing the importance of frailty assessment. Healthcare professionals have access to various tools to evaluate frailty. These include the Clinical Frailty Scale for quick assessments, the Edmonton Frailty Scale offering in-depth insights, and the Frailty Index, which assigns a score by analyzing multiple health factors for a complete evaluation. A comprehensive frailty assessment enhances treatment planning. By identifying potential challenges, treatments can be tailored to minimize side effects while maximizing benefits. This approach leads to better outcomes, improving survival and quality of life for patients under personalized care. Adopting a frailty-based approach transforms cancer care. Regular frailty assessment, personalized treatment plans, and supportive care help address this condition effectively. By moving beyond age, caregivers and providers ensure more nuanced, patient-centered care for improved outcomes. Integrating frailty assessments into routine care is key to improving outcomes. Continued research, standardized tools, and collaborative practices will help ensure that frailty is addressed holistically, empowering caregivers and enhancing treatment efficacy for cancer patients. If you are now more informed, please like the video, share it with your friend and family members, and subscribe to the channel. Thank you for watching. Have you ever wondered what Plato had in common with billions and billions of other people? None of them could escape death, but why? Welcome everyone. Today we explore aging, a fascinating and universal phenomenon that touches every cell of our bodies. This presentation will shed light on the biological intricacies behind the aging process and the discoveries shaping our understanding. Together, let's uncover the story of Plato's cells and the science behind life's inevitable trajectory. This is Dr. Armin Shahrakni, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. Aging is far from a single-dimensional process. It's a symphony of molecular and cellular changes affecting our entire system. These changes arise from both internal factors, like genetics, and external influences, such as environmental stressors. This dual interaction defines not only how we age, but also its pace and variability across individuals. The hallmarks of aging begin with the accumulation of genetic damage from free radicals and toxins, weakening cellular integrity. Mitochondrial decline reduces energy production, while changes in gene expression alter protein synthesis, disrupting cellular function. Additionally, telomere shortening limits a cell's ability to divide, fundamentally capping its lifespan. These markers provide the biological blueprint of aging. As age advances, the body's ability to regenerate tissues falters due to declining cellular efficiency. This is compounded by increased cellular senescence, wherein dividing cells halt reproduction, contributing to tissue wear and tear. The dwindling population of functional stem cells further amplifies this issue, undermining our body's capacity to repair and renew itself. Aging also brings a breakdown in cellular quality control, allowing misfolded proteins to accumulate and impair functions. Declining communication between cells disrupts systems coordination, while the buildup of damaged nutrients fuels oxidative stress. Together, these alterations create an environment of diminishing cellular efficiency and resilience. The result of these biological changes is a heightened vulnerability to diseases, diminished cognitive and physical functions, and a gradual loss of overall vitality. Ultimately, aging is the journey toward life's natural endpoint. This understanding offers a framework to address and possibly counteract the profound effects of aging on health. Researchers are making strides in decoding the aging process, exploring genomics, and examining interventions like gene therapy to delay or modify its course. While such advancements hold the promise of extending lifespans, they also raise significant ethical considerations. Is a longer life truly desirable, or does it come with unintended consequences? These are the questions science must navigate. Aging is a deeply intricate process born of both molecular and environmental forces. While science advances options to extend lifespan and mitigate aging's effects, these breakthroughs present ethical dilemmas that demand careful thought. Reflecting on these insights, we aim not only to prolong life, but to enhance its quality as we navigate the boundaries of possibility. If you enjoyed this video, please like it, share it with your friends and family, and subscribe to the channel. Thank you for watching.
Reimagining Care for Older Adults. Integrated Healthcare for an Aging World by Armin Shahrakni, geriatric oncologist. As the world's population ages, we confront both transformative opportunities and complex challenges. Traditional healthcare models often neglect the diverse needs of older adults. Today, we're advocating for bold changes, embracing a healthcare model that promotes active aging, respects dignity, and combats age-related stigmas. Together, let us champion care that benefits individuals and strengthens our communities. Let's address a critical issue: ageism. Too often, older adults are marginalized based on assumptions, not their abilities. Healthcare practices frequently exclude older individuals, failing to see the whole person. Solving these inequities begins with systems that integrate, empower, and value their contributions to society. The World Health Organization offers a clear path forward with its active aging framework. It focuses on 4 pillars: improving physical and mental health, fostering engagement in communities, ensuring safety, and enhancing quality of life for older adults. These principles serve as a roadmap toward healthier, more empowered aging. Active aging isn't one-size-fits-all. It's shaped by 6 key determinants: financial stability, healthy behaviors, psychological resilience, social connections, accessible services, and a supportive physical environment are all essential. Policymakers must address these areas to ensure equitable, comprehensive care for older adults. Traditional acute care models fail to meet the long-term needs of an aging population. By shifting our focus to chronic conditions and person-centered care, we take a holistic approach, improving individual well-being while addressing systemic healthcare inefficiencies. To truly support older adults, healthcare must account for more than clinical factors. We must design systems that integrate social and environmental perspectives. A person-centered approach unifies these elements for a comprehensive understanding of each individual's unique needs. Integrated care benefits more than just individuals. It uplifts families and entire communities. When older adults are empowered to contribute, everyone wins. It's a societal investment that enhances economic vitality, fosters intergenerational collaboration, and promotes inclusive growth. Let's leave here united around 3 objectives: revising healthcare systems for comprehensive aging solutions, fostering active aging through participation, health, and security, and confronting age-related biases. Together, we can build a future where aging is celebrated, not marginalized.
Welcome. Have you ever wondered what are the 5 easy tips for healthy aging? Aging is a beautiful journey when approached with care and purpose. Today, let's explore essential strategies to live a healthy, fulfilling life as we grow older. This is Dr. Armin Sharokny, a geriatric oncologist. I am double board certified in geriatrics and oncology. I have more than 12 years of experience in taking care of older adults with or without cancer. Our bodies deserve nourishment that supports vitality and wellness. Focus on balanced meals with fresh fruits, vibrant vegetables, lean proteins, whole grains, and healthy fats. By choosing these nutrient-rich foods and cutting back on processed snacks and sugary drinks, you can strengthen your immunity and safeguard your well-being. Movement is the key to staying energized and independent. Cardiovascular exercises like walking or biking keep your heart strong, while strength training preserves muscle and balance exercises such as yoga enhance coordination. Let's embrace activity at your own pace. It's never too late to get moving. Your mind is a powerful tool. Keep it vibrant. Dive into books, pick up a paintbrush, or even learn a musical instrument. Activities like puzzles or crosswords can also keep your brain sharp and stimulated. Challenging yourself mentally adds joy and richness to your days. Life is brighter when shared with others. Foster those precious relationships with family and friends. They nurture your spirit. Plus, explore opportunities to connect with your community. Join a local group, volunteer, or simply say hello. Building connections enriches your life in countless ways. Preventive care is your ally in maintaining health. Scheduling regular checkups helps catch health issues early and keeps you in control of your well-being. Don't shy away from discussions with your doctor. Staying informed and proactive is empowering and essential. Aging is an adventure meant to be celebrated. Take small steps daily, whether it's a stroll outdoors, nurturing meaningful relationships, or daring to learn something new. Each moment offers a chance for growth, joy, and wonderful surprises. As we wrap up, remember this: prioritizing healthy habits and embracing life's joys can pave the way to a fulfilling and meaningful future. Let's aim to enjoy every sunrise with gratitude and make every day a bright, beautiful chapter of our lives. If you enjoyed this video, please like the video, share it with your friends and family members, and subscribe to the channel. Thank you for watching.